Hello and welcome. Today we're diving into the world of digestive health to explore a common, yet often painful condition called choledocholithiasis. Simply put, it's the presence of gallstones in the common bile duct. Join us as we unravel the causes, symptoms, diagnosis, and management of this condition. So, what causes these unwelcome guests in our bile ducts? Choledocholithiasis usually occurs when gallstones, formed in the gallbladder, migrate into the common bile duct. These stones are primarily made of cholesterol or bilirubin, factors that increase the risk of gallstone formation in the gallbladder, like obesity, rapid weight loss, certain medications, and genetics, also indirectly increase the risk of developing choledocholithiasis. Let's trace the pathway of trouble. When a gallstone lodges in the common bile duct, it creates a blockage. This obstruction prevents bile from flowing properly from the liver and gallbladder to the small intestine. The buildup of bile can lead to inflammation and increased pressure within the biliary system. Furthermore, the obstruction can impede the drainage of pancreatic enzymes into the small intestine, potentially triggering pancreatitis. Choledocholithiasis is a relatively common condition, especially in older adults. Its prevalence increases with age, and it's slightly more common in women than in men. Individuals with a history of gallstones are at higher risk. The overall incidence varies geographically, influenced by factors like diet and lifestyle. Now, how does choledocholithiasis make its presence known? The symptoms can vary in intensity, but some common indicators include right upper quadrant abdominal pain, often described as sharp and cramping. Jaundice, characterized by yellowing of the skin and eyes, is another telltale sign. Other symptoms may include nausea, vomiting, fever, dark urine, and light-colored stools. Some individuals may experience no symptoms at all, making diagnosis more challenging. Diagnosing choledocholithiasis involves a combination of medical history, physical examination, and diagnostic tests. Blood tests can reveal elevated liver enzymes and bilirubin levels. Imaging techniques, such as ultrasound, CT scans, and MRI, can help visualize the biliary system and detect the presence of stones. However, the gold standard for diagnosis is often an endoscopic retrograde cholangiopancreatography, or ERCP, which allows direct visualization and potential treatment. While we don't typically classify choledocholithiasis into distinct types, in the same way we might categorize other diseases, it's important to consider the origin and size of the stones. Stones can be primary, forming directly within the common bile duct, or secondary, originating from the gallbladder. The size of the stone also influences treatment strategies. The primary goal of treatment is to remove the obstructing stone from the common bile duct. ERCP, mentioned earlier, is often used for this purpose. During an ERCP, a small incision can be made to widen the opening of the bile duct, allowing the stone to be extracted. If ERCP is unsuccessful or not feasible, surgical removal via laparoscopy or open surgery may be necessary. Following stone removal, the gallbladder might also be removed via cholecystectomy to prevent future gallstone formation and migration. Preventing choledocholithiasis largely mirrors the strategies for preventing gallstones. Maintaining a healthy weight, eating a balanced diet rich in fiber and low in saturated fat, and avoiding rapid weight loss can all help. For individuals at high risk, medications like ursodeoxycholic acid might be considered to prevent gallstone formation, though this is typically reserved for those who cannot undergo surgery or have other contraindications. The prognosis for choledocholithiasis is generally good with timely diagnosis and treatment. However, untreated choledocholithiasis can lead to serious complications, such as cholangitis, bile duct infection, pancreatitis, and liver damage. Recent research focuses on improving non-invasive diagnostic techniques and refining ERCP procedures to minimize complications. The development of new medications to dissolve gallstones within the bile duct is also an area of ongoing investigation. Thank you for joining us on this exploration of choledocholithiasis. Remember to consult your healthcare provider for any health concerns.